Welcome to Retirement Talk Radio, your guide to and through retirement. Adam, we have a special edition of Retirement Talk Radio today, Loving Legacy and an end-of-life discussion. And ladies and gentlemen, this is a little different show than what you have heard in the past on Retirement Talk Radio. I think it's an important discussion. All of us have to face this journey, or we know a loved one, perhaps now or in the near future, something that all of us, regardless of age, have to face at one point in time. There are some financial aspects to this type of planning, and I wanted to take time for today's show to talk about some of the issues surrounding end-of-life care. In particular, we're talking about terminal illnesses and individuals that face this on their journey in life. And it's really not discriminatory to any specific age group, is it, Adam? Right. Anyone can face an illness at any age. It's not just the elderly.
That's right. Anyone can find themselves in hospice depending on their situation at any given time. So, yes,
now,
exactly.
There's some misconceptions and things about hospice, and we want to try to put a little perspective on this. I think this is an important show, and I want to cover some key things here before we speak with our guest on today's very special edition of Retirement Talk Radio. Obviously, there becomes circumstances when a patient cannot stay at home or with home health hospice, a wonderful program, but there are certain situations where that's just not in the patient's best interest, not in the family's best interest, trying to take care, and the needs may become more demanding. At some point then, for pain management, for all sorts of reasons, there comes a time through the disease process, and hospice is provided by a specially trained team that cares for the whole person, including his or her physical, emotional, social, and spiritual needs. Some of the things that hospice does is provide support to family members, and it's generally given in the home or an inpatient facility, of which you would choose to perhaps take advantage of an inpatient hospice when care is no longer manageable at home. And in the Northwest Ohio area, an inpatient facility is available at the Defiance Area Inpatient Hospice Center in Defiance, Ohio. Hospice services may include drugs, physical care, counseling, equipment, and supplies for terminal illness and related conditions. Hospice is not only for people with cancer. That is very important. A lot of people get cancer. It's a very painful illness, but there's other things that would qualify where someone is going to need to have a hospice program. It does not shorten or prolong life. I think that's a misconception when we were speaking with our guest before we hear from Ronda Lewis later in the show. They do not shorten by over-medicating. They do not prolong life by doing other treatments and things. It's to manage day by day, night by night, what the needs are. And I have seen firsthand just the wonderful management, knowing what drugs to go to when. And multiple issues come up, especially when a person is terminally ill. There are other issues to treat just besides pain management. And we want to get into some of those aspects a little bit today. And hospice focuses on comfort, not curing the illness. You're terminally ill, and you want quality of life. So understanding some of these things, it's a very encompassing topic, but we want to make sure we have some clarity on this. I think it's very important. Some areas in the palliative care questions that comes up would include things for palliative care versus hospice care. Some questions, Adam, that we were talking about before we started the show today. Who can receive this care? Well, if we look at palliative care, anyone with a serious illness, regardless of life expectancy, can receive palliative care. What would the hospice care be in contrast to that?
It'd be someone with an illness with a life expectancy measured in months and not really years.
Okay. Some other questions. Can I continue to receive treatment to cure my illness? Well, if you do palliative care, you may receive palliative care and curative care at the same time.
But with hospice, the treatments and medicines are aimed at relieving symptoms and are provided by hospice.
Does Medicare pay? Here's our financial topic in the show. Under palliative care, some treatments and medications may be covered.
But with hospice care, Medicare pays all charges related to hospice. That's great.
Yes. Does Medicaid pay? Okay, so Medicaid and Medicare, two separate entities. Medicaid for those who have no self-insurance or Medicare coverage. Some treatments and medications may be covered under palliative care.
And with hospice care, in 47 states at least, Medicaid pays all charges related to hospice.
And I think private insurance is an important one to cover.
Sure.
Some treatments on palliative care are covered and medications may be covered.
Right, and most insurance plans have a hospice benefit as well. So,
how long can I receive care? Under palliative, this will depend upon your care needs and the coverage that you have through Medicare or Medicaid, or if you have private insurance.
And depending on the hospice, as long as you meet their criteria of an illness with a life expectancy of months and not years.
Okay, and I think it's real important to point out as well where our services provided under palliative care would be home, assisted living facilities, nursing facilities, and hospitals.
And with hospice, it's usually wherever the patient resides. It's in their home or assisted living facility, in a nursing facility, or maybe even a hospital. And some hospices have facilities where people can live like a hospice residence or receive care for short-term reasons, maybe such as acute pain or symptom management.
We're going to talk about this and much more when we come back with the director at the Defiance Inpatient Hospice, Ronda Lewis, and we're going to dive into some life journey questions and explain the whole program a little more fully. You're going to want to listen to this. It affects all of us at some point in time. None of us are immortal, unfortunately, and a part of life. So with proper planning, as always, guiding you to and through retirement. We'll be right back on Retirement Talk. Your guides to and through retirement. I'm your host, Laura Stover. You're listening to Retirement Talk Radio. Today we have a very special show, a little non-typical of some of the discussions that you have heard in the past here on Retirement Talk Radio. An important part of investment planning and estate planning, tax planning, and having a comprehensive plan due to personal experience and the fact that all of us face these types of life challenges at one point on our journey in life. I thought it very prudent to have a special edition of Retirement Talk Radio today. An end-of-life discussion, in particular on hospice. All of us probably can relate to a time in our life where either our grandmother, our grandfather, a close person to us has went through a journey and we've lost someone that we love or know. And these life-changing events that occur, and almost like a birth when a child is born into the world. In many instances, short of an accident that takes people suddenly, most of us are going to experience a journey in the dying process. And we want to go over some key things on a couple of aspects about this topic. Obviously, there's a financial aspect, how to plan for these types of costs. And we want to talk about the Medicare aspect in terms of some things that are paid for and not paid for. Dive into a little bit of the psychological process and choices that families can have during these times. If you know someone that's been diagnosed with an illness or is terminally ill, that's specifically more or less the direction of today's program. And I am delighted to have on as a guest with me here today, Ronda Lewis. She is director as a nursing supervisor at the Defiance, Ohio Inpatient Hospice. Ronda, welcome to Retirement Talk Radio.
Oh, thank you, Lori. I'm glad to be here.
Rhonda, I have had the privilege of meeting you recently, and I guess I will add this note to our listeners. My mother, as we speak today, Thelma, is a patient at the Defiance Hospice. She has been there since about April 15th. It's a very trying time, and I wanted to bring this program to our listeners because I think that you are one of the best kept secrets for when people are in this type of situation. Maybe there's not a lot of awareness about choices. So let's start, Rhonda, with a little bit of the discussion in terms of what is palliative care. Let's start there. Some of the key areas, if someone has a serious illness and they have a life expectancy, we've heard this terminology called palliative care. How does that exactly relate to hospice, and what aspects of that verbiage would someone want to be in tune to? And how does that relate? It kind of relates to if a person is on Medicare. Let's assume they are on Medicare, what things Medicare pays for and what it does not cover. So let's start with a little financial discussion and then kind of migrate from there.
Yeah, when somebody's on hospice, the doctors deem that they're in the last 6 months of their life. Medicare does help quite a bit. When they are inpatient hospice center and they have symptoms that need to be managed, such as out-of-control pain, out-of-control nausea, anxiety, all those issues that are very difficult and unmanageable at home, they can come in at the hospice inpatient center, and there's 24 hours of nursing. Medicare will pay 100% of those days when the symptoms are out of control, and the nurses are working very hard to get those under control for them. Now, on the days when they become stable as far as their symptoms are very much under control and they're pretty much comfortable, we can say Medicare will still pay for the nurses and things like that, the medications to make them comfortable. They will not pay for a room and board on those days. Currently here at the Hospice Inpatient Center, that's $145 for those type of days. They typically, when they are here at the inpatient center, they come in and out of those days. They may have a couple days where the symptoms are managed, but the end of life, a lot of times symptoms change so quickly that then you're right back into seeing what other symptoms, whether the pain increases, whether the nausea increases, some anxiety, things like that. Insurances also will typically follow Medicare's regimen as far as what they pay for.
And that's a little bit of the roller coaster that some families find themselves on. It's a little bit of a teeter-totter sometimes with the changing condition status. I know from personal experience there's a little bit of that struggle where you want to keep them home as long as possible, and perhaps people will call in caretakers or friends and families that can help. It becomes, when is the decision process? Let's talk a little bit more about the pain management. I've seen just firsthand some of the things that you can do, and you mentioned anxiety, and I'm not sure a lot of people anticipate there's a medical reason why it's not just anxiety from being stressed out necessarily because I had a bad day and I'm very busy today. It's becomes as part of that terminal illness and special things that go along not only with pain management, but can you talk about that a little bit, and when a family might determine that it's a little too difficult to maintain the comfort level at home and the care that the loved one may need at that point, and how would they make the decision to transfer over, and how does that process work from home health hospice to the inpatient?
Yeah, if they're on the community health program, they would just transfer in. Say they're on our Bryan program. We've just opened a new office in Bryan. They would just come directly here. Hospice would pay for the transportation to here, and there wouldn't be much of any change to them other than the change of the residence for that patient. As far as anxiety, a lot of that would come from if a person gets short of breath. Maybe they have lung cancer or such. Then when you're short of breath, if you can't get your air or you feel like you're struggling a little bit, that anxiety is very real. And it very much becomes a huge symptom that you want to manage. You're not comfortable. There's a thing called, and a lot of people will go through it, is called terminal restlessness. That's where a lot of talking becomes when anxiety gets out of control, when that position, that symptom starts to take effect. But as far as transferring, there's not much to that as far as disruption, as far as from their home health to the inpatient center. Sometimes they'll come in for a respite stay of 5 days, which Medicare does pay for that 5 days of respite. They will go back home with their caregivers on that 6th day. And usually people determine when they come in here, it's when they're overwhelmed. They've been up days and nights, for 2 and 3 and 4 days in a row and just really can't do it anymore. The symptoms are keeping the patient up at night, difficulty sleeping, the anxiety like I had talked about, the pain. There's nothing like having a loved one in your home and you're watching it where it's in your face and you're watching them kind of suffer. And you want the best care for your loved one and somebody to help you along that way. Hospice is going to be your biggest advocate. They're going to work very hard to take care of that pain and manage it. The nausea, they're going to really work. When they are at home, and they do get very good care at home, but a nurse is only able to be there a couple times a week sometimes, and some respite care up to 24 hours a week. But when it's very overwhelmed and you need 24 hours of care, we're so lucky in Defiance and the surrounding areas to have this facility to help the families. Like you had mentioned, we are all going to be at the end of life at some point. And a lot of times it isn't just a quick accident type of thing.
No, it's often, I kind of equate this, and my mom always had said this, it's like when a baby is born, there's a process. Mm-hmm. And with most people, everyone's different in the dying process, but with most people, there is a process in terms of our exit beyond this life, and that's a little different for everyone, but you guys are the best at making that journey as smooth as possible. No scenario is perfect, but you have done remarkable, I can say firsthand. And we're going to have to take a real quick break, but if any of you listening have questions on wanting more information or how to speak with Ronda Lewis or a representative with the Defiance Inpatient Hospice, you may call our planning line at 1-855-419-PLAN. That's 1-855-419-7526. We will be sure to connect you with the right person to speak with at the hospice facility or someone to consult with if you or someone you know is going through a trying time with a loved one and an illness, or you just have more questions and you want to know more about this. We'll be right back with more with Ronda Lewis from the Defiance Inpatient Hospice here on Retirement Talk Radio after this. You're listening to Retirement Talk Radio. I'm your host, Laura Stover. With me today, I am speaking with nursing supervisor Ronda Lewis. She is over the Defiance, Ohio Inpatient Hospice. And we're having a discussion now on advanced directives. And I know we were talking during the break, Ronda, you are seeing more younger individuals. It's not just the elderly who would utilize your facility. You were saying that there's some patients coming in only in their 30s and 40s. Can you talk about the importance of making sure, regardless of what age you are, having what we refer to as durable power of attorneys for health care and living wills, and how this could affect an individual, especially if they're tossed into a situation where they'd need a hospice program?
Yeah, you never know. Even your age, like I said, we're seeing a lot more people come in their 30s and 40s and 50s. And when they come in, they're not having advanced directives in place at this point. They're not thinking, I'm going to be at terminal at that age. But, it can be a very realistic thing that can happen to you. If you have a living will in place, that's going to state your wishes. And a durable power of attorney for health care for somebody to make the decision for you should you become unable to make that decision. A living will and durable power of attorney takes the burden off your families to make that decision for you. If you have those advanced directives in place, that's going to make your wishes known so they can follow through with whatever that they will know, and they're not going to have to make that decision, whether it be even life support or feeding tubes, things like that. And you're going to put a person in place and let them know what your wishes are. Like I said, the families will so much appreciate that because they're not having to make those tough decisions in a bad time when something does happen.
Right, and I think all of us having that ahead of time is enormously important to take the burden, and just so those things are discussed ahead of time. Often these are not topics that people like to talk about at the dinner table on a regular basis, but it is very important to make sure that we have some of those things in place. You do not necessarily need an attorney to implement some of this. You may choose to discuss the matters with an attorney, but there's no requirements to do so in order to obtain these documents. Is that correct, Rhonda?
That is correct. Those documents, they just need a couple witnesses on there. Actually, our social worker does do them documents for people enrolled in the hospice program. But if you ever have any questions on that, I'm sure that, if you stop by one of the offices for home health, they would be more than happy to answer questions about those documents and set you up to get them in order.
And I'm going to provide your facility's phone number once more, the Defiance, Ohio Inpatient Hospice. For more questions on any of this, you may call 419-782-4131, and someone will consult with you on any questions on any of the topics that you are hearing today. Or please call our planning line, and we'll put you in touch with the right person there at the Defiance Hospice, 1-855-419-PLAN. Moving on a little more, Rhonda, the facility there in Defiance is, for as sad as this can be, it's a beautiful facility. It's kind of tucked away off of Route 66 just before you get into Defiance, a little wooded area, beautiful facility. You're about a 12-bed facility, beautiful rooms. I've noticed the pond outside my mother's window, and it's a nice place. The way that you've kind of got this put together, it's so comfortable for families to feel like they're at home in the room, because sometimes she's been there for quite a few weeks. Can you talk about the facility and some of the services that are available? I know my mother made the comment she felt like she was at the spa, and it certainly helped where they can still enjoy a few things on their last days.
Yeah, we try to keep it very quiet and peaceful here. We don't have a lot of bells and whistles or a lot of noise in the facility. To help the patients relax, we give massage therapy. We call a massage therapist in. We have volunteers. Some of our patients can't feed themselves, or they may be left in the room and there's not a lot of visitors. We do have volunteers that come and sit with the patients and talk with them, feed them. They bake cookies for the visitors. We have a chaplain on staff. He will come and visit and talk with the patient to make sure that spiritual aspect is taken care of. We have a social worker to help with things like the durable power of attorney or health care and the living will. And she does many other things besides that. I mean, that list is so long I couldn't even begin. We also have an angel foundation for special wishes for people. Maybe they want to go to a Tigers baseball game, or they would like to go antiquing, or maybe bring in a family member that's out of state if we can get them here, to say their goodbyes. Or maybe they have a member that is overseas in the service. Our social worker can make the phone calls to that the service that they are in and get them home to say their goodbyes also. And that is so very important. We have a lot of those kind of people overseas that, we're worried about and when we want to see them. We also have a music therapist that comes and will sing for people that might enjoy that, too. We have a chapel here at the inpatient facility for people to go into a quiet area and kind of congregate and talk peacefully, too. So there's a lot of different things. Like you said, it's a 12-bed facility. Our nurses have about 3 patients each. They do all the primary care. So, there's not a long wait for when you need pain medications or nausea medications or, whatever you need. It's pretty quickly taken care of.
And I know from firsthand experience, I will say this too, every single staff person and every nurse that has journeyed this path with my mom in particular, all are highly trained. There's a difference when you're a hospice nurse from the treatment side, that many hospitals, the training's a little different, and there's some different aspects to really knowing what's going on with those patients. And I know on a personality standpoint. The kindness and the know-how for communication is one of the things that have stuck out to me, and that comforting way that they touch or speak with the patient when they are going through these transitions with their disease process, that brings them some stability and comfort, and they have more comfort knowing that you know how to manage their pain, because some people say they're not necessarily afraid of dying, but that pain is a scare. I know it was for my mother, and you have moved heaven and earth literally to bring in everything that is a protocol to make sure your patients are comfortable. And I know every single nurse that's worked with her has been just the most gracious, communicative person. I say that wholeheartedly. A kind staff and very attentive. So if anyone has questions, again, on any of the topics that we have spoke on today's special edition of Retirement Talk Radio, call 419-782-4131 to the Defiance Inpatient Hospice, or feel free to call our planning line here at Retirement Talk Radio, 1-855-419-7526. Ronda Lewis, thank you so much for your time today, and God bless you for the wonderful work that you and your team does at the Defiance Inpatient Hospice. For Retirement Talk Radio, this is Laura Stover. See you next week.